Good afternoon. Today is Tuesday, October 27th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. Last week, the Governor announced a new microcluster approach that the state will be using to monitor COVID outbreaks and regulate activities. Previously, the decisions on when a county could resume activities, such as indoor dining, were made on a regional level. The numbers for all the counties in the region were considered when restrictions were implemented or lifted. Now, instead of using regional benchmarks, the state is looking at smaller focus areas to implement and adjust restrictions. This will involve a more targeted and detailed approach to pinpoint the center of an outbreak or cluster. Instead of across-the-board shutdowns, restrictions will be focused on the center of the outbreak and surrounding buffer zones. The State Department of Health has already done this downstate, where they are looking at positive testing rates, population, and other data to control clusters of cases. Restrictions on mass gatherings, dining, schools, and businesses are triggered by infection rates and other data. Areas that meet the thresholds are designated as red, orange, and yellow zones. Counties are classified by their population density instead of their geographic region. Oswego County falls in Tier 3 because our population is more than 50,000, but less than 150,000. In Oswego County, in order for a microcluster to be classified a yellow zone and generate additional restrictions, it would require a positive test rate above 3.5% for 10 days and 15 or more new daily cases per 100,000 residents on a 7-day average. There are higher thresholds and more restrictions for orange and red zones. We hope it doesn't come to that here in Oswego County, but this seems like a more reasonable approach. To put this in perspective, our positive test rate for the active COVID cases has been 1% or lower for the past several weeks. In the past 2 or 3 weeks, we have seen increased COVID-19 activities. Most of the positive cases were associated with small clusters in households, families, or groups. The affected residents were mostly adults of varying ages and from communities of all sizes throughout the county. The bottom line is, people still need to follow all the preventative guidelines. Whether we like it or not, these restrictions are in place for a reason, to protect the health and safety of our residents and prevent the spread of COVID-19 in our communities. Gatherings of more than 50 people are still not allowed. Bars and restaurants across the state are being penalized for not requiring customers to social distance and to wear face masks. All business owners need to be following these rules and enforcing them with their customers. This is especially important in light of today's COVID-19 report. Sadly, we have lost one of our neighbors, marking the 5th death in our county related to the coronavirus. On behalf of the county, I would like to express our condolences to the person's family and friends. And now I ask Diane to report on the Health Department's monitoring programs and testing over the past week. Diane?
Thank you, Mr. Chairman. In the past week, we have had 40 new reports of COVID-19. While this number is cumulative over 7 days, it shows us that the virus continues to spread throughout our communities. We are continuing to see clusters in households and small groups. This week, our 7-day rolling average of people who tested positive for COVID in Oswego County is 0.8%. As of today, we've had 61,073 COVID tests done. We have 774 positive results. We have 39 active cases. We have 730 that have been released from isolation. We have 5 deaths related to COVID. We've received 60,119 negative test results, and we currently have 212 residents in mandatory quarantine or isolation. A total of 3,536 antibody tests have been reported to the County Health Department with 88 positive results. Our rate of infection for antibody testing is 2.5%. Today, I also wanted to mention that this week is National Lead Poisoning Prevention Week. The Centers for Disease Control and Prevention estimates that 535,000 children living in the United States have blood lead levels high enough to cause significant damage to their health. Locally, we are currently monitoring 51 Oswego County children with elevated blood lead levels. Common sources of lead poisoning include drinking water from lead pipes, peeling or chipping lead-based paint, toys or jewelry that contain lead, and lead-glazed pottery. Many houses built before 1978 have lead-based paint. Children can be lead poisoned by breathing in or ingesting lead dust or paint chips. Children are more vulnerable to lead poisoning than adults, and those under 6 are most at risk. Health effects on early childhood development can be severe. Even small amounts of lead can affect a child's mental and physical growth, causing learning disabilities or disorders in coordination. Some of these effects can last beyond childhood. Here are some tips to help protect your children from lead poisoning. Get your child tested at ages 1 and 2. Keep the area where your children play as dust-free and clean as possible. Make sure your children do not chew on painted surfaces. Report chipped or cracked paint to your landlord if you live in an older home built before 1978. Keep yourself informed about products that are recalled for high levels of lead in them. For more information about lead poisoning, call the health department at 315-349-3547. The health department continues to staff the COVID-19 hotline. Anyone with questions can call the hotline at 315-349-3330, Monday through Friday between 8:30 and 4 p.m.
Thank you, Diane. We're heading into colder fall weather. Please stay home if you're sick and get your flu shot if you haven't already. If you have COVID-19 symptoms, please contact your primary care doctor and arrange to be tested. Halloween will be different this year. I hope all of our residents have a safe and healthy celebration. Thank you to everyone who is doing their part to prevent coronavirus from spreading. You are making a difference.